Friends, today's discussion is about my post-menopause journey and how Sinopol is still helping me. You will remember that Sinopol was an active part of my trying to conceive journey, as well as being there for me during my perimenopause stage. At 51, I am now post-menopausal, but Sinopol continues to help me with my symptoms. As we all know, being post-menopausal tends to increase the risk of being overweight. But what you may have not known is that you are also at risk of developing metabolic syndrome. Together with a low-calorie diet and my daily intake of Sinopol, I have been able to continually manage my insulin resistance as well as my BMI. The result is that I feel wonderful. I am full of confidence, and Bongani has noticed this too. Remember, if you are battling with PCOS symptoms, wherever you are on your reproductive health journey, be sure to ask your healthcare provider about Sinopol. From myself, Lerato and Bongani, be kind to each other and we will catch up next time.
Okay. So that was a little story, and we started this journey with IFASA. It was about 2 years ago that we started with this Bongani story with Sinopol. So my name is Adéle Beyl, and I am working for iNova Pharmaceuticals, and I'm the brand custodian for Sinopol. And it's really a product that's very close to my heart. I can tell a personal testimonial story of my own family where Sinopol has really been an absolutely amazing product who made lots of people pregnant. So first of all, Sinopol is indicated for polycystic ovarian syndrome, and it helps to correct hormonal imbalances. So when we're talking about polycystic ovarian syndrome, and I think many people that's here or that's been diagnosed with polycystic ovarian syndrome has done a lot of research, but about 80% of women that actually have this condition doesn't know that they have it. But I think when you've been diagnosed, you know about it, you've actually done a lot of research on it as well. So the active ingredients that is in Sinopol is myo-inositol. It's got alpha-lipoic acid and folic acid. So what differentiates us from all the other polycystic ovarian health supplements currently on the market is that we've got alpha-lipoic acid in. So we're the only ones that's got alpha-lipoic acid in, and it's not just a normal ALA, it is a slow-release ALA. So it is really quite novel technology that's been built into this product. So when you are taking your Sinopol, it also comes in sachets. You've got to take it twice a day. You will see the little yellow granules that is in the consistency. So when you start mixing it for about 6 to 7 seconds, you will find that this consistency becomes a little bit thicker. And the technology behind that is to disperse those little granules to make sure that you are consuming all those alpha-lipoic granules, which is a slow release. So normal alpha-lipoic acid works for about 40 minutes, and that's where the problem comes in. It has to work for 24 hours. So ours works for 12 hours, and that's why you have to take it twice a day. And you have to take it an hour before you are having your meals. So I always say to patients or consumers, make sure that you just put it next to your bed with a little bit of water. The next morning when you wake up, quickly mix it, have it, and by the time that you got ready, then it will already be in your system for about an hour before you're having your first meal. Your second one run about 4 or 5 in the afternoon, and then after you've cooked and your meal is, or your dinner is ready, then it's already in your system as well. So this is the only polycystic ovarian syndrome health supplement that's got sound and a lot of clinical data actually being done on the product itself that supports evidence behind Sinopol. So that's why I always say you always just have to look at the clinical evidence, and the clinical evidence is there. So we've got clinical data that supports almost all the areas that's being affected with polycystic ovarian syndrome, being your insulin resistance, which is very, very important because insulin resistance causes PCOS and PCOS causes insulin resistance. So it becomes a vicious circle. that we have clinical data in. Secondly, it is oxidative stress, because oxidative stress is causing inflammation, which is really not good for your ovarian area and for your oocytes. That's your egg cells. So they just don't like it. And basically, oxidative stress is, right at the beginning, I just wanted somebody to explain to me, what is oxidative stress and what does it actually do? And the easiest explanation that I could find is that once you cut an apple open and you leave it, it starts to become brown because it starts to oxidize. And when you leave it for 2 to 3 days, it starts to really go off. And that is basically what is happening with your cells in your body if you have a lot of oxidative stress and a lot of free radicals floating around in your body. So it's basically causing inflammation, and it's dying off some of your DNA. So that is what oxidative stress does. We have clinical data with regards to that. Then also the third thing is hyperandrogenism. That is when you've got a high level of male hormones in your body that's causing a lot of trouble and drama. So we've got clinical data that we are bringing and reducing the high male hormones in your blood as well. And then lastly, your hormone imbalance with your reproductive health issues, that you are not ovulating because of this imbalance. And with Synapol's got clinical data to support this. So what you can also see from the main ones that's standing out is if you are using Synapol while you are on IVF, it increases the chances of success rate by 44%, which was done on actually on Synapol, not just on the active ingredients. So that is amazing. I always say when you start thinking of doing IVF, already start on Synapol. With all health supplements, you have to take it for 3 months before you can really see the effect. Personally, from a lot of feedback that I've seen with patients is that you might start seeing a hormonal effect within the first 2 weeks already if you take it the way you should take it and you take it religiously every day. So it really starts to work fast, but to be on the safe side, use it for 3 months. And once you've started, please don't stop. I've just had a discussion with a patient at the back. We're all human beings, and we're all very bad with compliance. But if you make a concise decision that you actually want to be on this journey and you don't want to waste your money, then this is really a drop in the bucket compared to IVF. But just start using it ASAP. Even if you start the IVF process, start making your appointments, start going for blood tests, start using it already from the beginning that you need to go onto this journey. What we also saw that there was a 45.5% reduction in insulin resistance. Insulin resistance is a big contributor to PCOS. So really, really important and amazing data. We also saw an 8.4% reduction in obesity, and we also saw a 16.4% reduction in your hirsutism. That is your unwanted hair growth, which is common with polycystic ovarian syndrome. So, this is what Synapol is. Our stand is at stand number 7, right at the back. If you would like to come and speak to us a little bit further, please come and join us and chat to us about your personal story. This is the 3rd year that I'm at this conference or congress, and it's just amazing to speak to consumers where people really share their story with you, and it's very personal, and people don't often want to speak out about it. But come chat to us. We are more than willing to chat to you and to give you more advice and support. We also have a website, www.synapol.co.za, also with quite informative information on there, so you're more than welcome to visit our website. And if you need to be in contact with us, you just go into contact and just write us a little message with your contact details, and we will get back to you. So thank you so much. Enjoy the rest of the congress and this event. And thank you to Saskia. She's the amazing woman. She was the seed behind this entire initiative, and she is really a great person with a lot of energy. So, yeah, thank you to you for all of these people.
Thank you so much, and thank you for supporting us all the time. We really do appreciate it.